All right, our second guest on the Sports Doctor tonight, joining us on the phone, Dr. Eric Williams, chiropractic physician, owner and founder of Williams Chiropractic Center in Lisle. Dr. Williams, thanks for joining us.
Well, thank you very much, Chris and Dr. Weil, for having me.
I've been trying to get this guy for, 10 years? I've been trying to get Eric. Eric and I both are members over at the terrific Edwards Health and Fitness Center in Woodridge. If he's not playing basketball there or talking to some of the guys and whatever. So we're thrilled to have him on and talk a little bit chiropractic sports medicine. Give us a little bit of background. I know you've been in Lisle, 22, 23 years. Give us a little bit of background, if you would, Dr. Williams.
I've been practicing here in Lisle on Ogden Avenue for 23 years, and it's gone fast. I started Williams Chiropractic Center, and we've just grown ever since. In April, I'll be celebrating my 24th anniversary.
Wow. Now, you have been involved in in town. I mean, you've been, talk a little bit about some of your involvement with the Lisle football program.
Well, I've been on the sideline for the Lisle High School football team for the last 16 years. Also on the sideline, we have a trainer and we have an orthopedic surgeon. So we're just trying to do what we can to keep the guys as healthy as possible. As you know, football is a very rough and dangerous sport, and I bet every game we have one or two injuries.
Oh, yeah. You know, it's amazing. Is it everybody imagining, or are these kids so much bigger and so much stronger than we ever remember?
Oh, definitely. And that's definitely why you're seeing more concussions, the head-type injuries, and just more neuromuscular skeletal injuries, definitely because of the size and the increase in speed.
Talk a little bit about the role you play, for example, with the school and the team. Do you do preseason screenings, Dr. Williams? Do you do analysis during the time, see kids who are hurting? How does that work?
I work hand in hand with the trainer and with the coaches. So as soon as they spot an injury, typically they'll send them over to Williams Chiropractic Center, and we can do an evaluation. And I can kind of work as a triage. If I can't take care of the problem here in the office, I'll send them to the appropriate medical specialty so that problem can be treated properly.
Are more and more high schools and high school athletic programs using chiropractic services?
Yes, definitely. You know, if you look at some of the top-notch sports, just the NFL and the NBA, they all have chiropractors on staff. So you're now starting to just filter down to the colleges and to the high schools where chiropractic care is being utilized.
Yeah, I think that's definitely a great addition. I remember it wasn't that many decades ago, and it was such a challenge. I don't know a serious athlete, Dr. Williams, who doesn't include chiropractic care in he or she's repertoire.
Right, yeah, you can look at all your top-notch athletes, and they've used chiropractic care. You know, you can look at Derrick Rose. He had a back injury last year, and he talked about how he used a chiropractor, and that got him back on the field, back playing again.
I remember one of the world's great commercials in the past was when Joe Montana, during the Super Bowl, might have been halftime, when he went into the locker room, got his chiropractic adjustment, and made a big deal out of it. What an incredible moment that was for chiropractic medicine with Joe Montana. I think that might have been in the 80s. It might be dating ourselves a little bit here. What are some of the problems and concerns you'd have preseason with some of these high school athletes? Do you get involved in screening and looking at body types and trying to prevent problems at the same time?
Absolutely. If we can take a look at, do some pre-screening for scoliosis, which is, you know, the curvature of the spine, and weak muscles around the spine or around the joint, we can address that prior to them going out on the field starting the season. And we can teach them exercises or make adjustments to fix that problem.
We've talked about this before on the Sports Doctor, but do most people have some type of alignment issue? Are most of us perfectly aligned, or are most of us dealing with some trouble?
I bet majority are dealing with some type of trouble. We get misalignments of the spine. We got 24 moving vertebrae in the spine, and they move in all different directions. And they get misaligned. You can fall as a kid. You can, you know, sports and impact like that, and car accidents, and sleeping improperly.
Sitting all day.
Sitting.
Right.
Poor posture at work, sitting incorrectly.
And what can you learn on, say, the first visit when you first see someone and maybe get your hands on them, can you pick up a few things immediately?
Yeah, usually what I'll do is they'll come in the office, we'll do a consultation and a thorough history, and then we'll get into the examination. At that point, we can determine if they need x-rays possibly in the office to look at the spine or the joint a little closer, and then we can give the feedback back to the patient on what we're picking up.
Yeah, there's always been a great marriage between chiropractic medicine, where they might be looking from the hips and the waist on the way down, and podiatry and sports podiatry, where we're looking at the feet, the ankles, and on the way up. You're listening to the Sports Doctor here on 90.9 FM, WDCB. I'm Dr. Bob Weil, sports podiatrist. I'm here with sports editor Chris Fox. We're talking to chiropractic physician from Lisle, Dr. Eric Williams. Great example of the great guests we have all the time. If you want to listen to some past shows, go to sportsdoctorradio.com. Great examples. Being a member of a health club, there's so much exercise going on, a lot of personal trainers, therapists all over the place. What's your take on what's being done right and what might be done so right when it comes to the health club world? It seems like Edwards does a great job.
Yeah, Edwards does. They do a wonderful job. They have educated, trained, licensed, certified personal trainers that can properly assist someone in reaching their goals, and reaching those goals in a methodical way that's going to help them obtain the results that they're looking for quickly. And that's important, and safely.
Because people are lifting weights, people are running, people are doing all sorts of different activities, Pilates, people might be swimming. So as a chiropractic physician in this whole sports medicine area also, what's a good mixture to you, Dr. Williams, when you talk about a real good all-around fitness and activity program that would stay out of trouble as far as our back is concerned?
Well, just general exercise. I like cross-training. You don't want to do one particular thing too much. Someone I think can run too much, or they can play tennis too much. Cross-training is so crucial with the spine and the back, because you're working the muscles at different angles and at different levels. So I think that mixture is important. Yeah,
we used to hear stats floating around in the different specialties also, which was that over half the population in some way, whether it's functional or structural, has one leg longer than the other. And I don't argue with that from a sports medicine point of view. What's your take on that?
Yeah, I think that's when definitely they can utilize an orthotic in the shoe to make up that deficit, or looking at the pelvis to see if the deficit is coming from the pelvis. Now, if we can make adjustments on the pelvis, then we should be able to reduce that deficit, that leg deficit. And now that person's going to be able to function better at a higher level, increase flexibility, range of motion. That's just going to help to make a better athlete.
Like in general chiropractic medicine also, Dr. Williams, it seems that, years ago, the very, very older population, the super senior population, would take advantage of chiropractic medicine. Now it's, again, very, very much active people. How young, also, children-wise, do you include chiropractically?
Well, believe it or not, I can check a newborn spine to determine if there's any problems. And we've had newborns in the office, and we've made adjustments. They're very light adjustments. So you have to be able to know what type of force to use on that spine. Obviously, with a newborn, you're using just a gentle force. And some of your athletes, I'm using a little heavier force to get that spine to move into better alignment.
I remember doing adjustments and manipulations on big people and athletes. That's physically demanding, isn't it? Who's taking care of you?
I have a chiropractor in Naperville that I use on a regular basis.
Who's that?
Dr. Mark Fromm.
Okay, Dr. Fromm. Okay, yeah, hey, Mark. Absolutely, that makes a lot of sense to be taking care of yourself at the same time. And what are some of the other common problems you see in your everyday practice with active people?
Well, typically, the common things are going to be neck pain and headaches and low back pain, upper back pain. But then we go all the way to all the joints. We're licensed in Illinois to work on all the joints in the body. So we work on strains and sprains through physical therapy, adjustments, in helping them to strengthen those joints in that area. So we might use exercise, we can use nutritional consultation, vitamins, and herbs. We're basically trying to restore the body back to homeostasis through natural means.
That was always, I feel, something that set chiropractic medicine aside, Dr. Williams, which was the attention to nutrition, the attention to exercise and natural things way before MDs paid attention to that. Do you agree with that?
Oh, absolutely. I'll have someone walk in my office and want my help with reducing their blood pressure. Well, I'm not going to do anything with medication. I'm not going to do anything with surgery. We're going to be looking at exercising, nutritional consultation, them taking some vitamins and herbs to see if we can do things naturally to bring that blood pressure down. And 9 out of 10 times we do. If we can't, then yes, they need to go to a medical doctor and let them step in with medication.
Are there still one or two misconceptions people have about chiropractic medicine?
Absolutely. And one thing that I hear quite a bit is once you go, you have to go all the time. And I beg to differ. I think I can put a person on a treatment plan, get them better, and then see if they want to do a maintenance schedule where they come in once a month, once every 2 months to maintain their spine and maintain their health and stay healthy as possible.
See, prevention's a tough sell, isn't it? It makes so much sense, but you want to stay healthy, then some consistency. But I think it's one of the downsides of our healthcare system, Chris, is we're a sick care system. When am I done with my medicine and I can go finish? Compared to like what Dr. Williams is talking about, with some sort of maintaining optimum health, optimum alignment. But if you want to be out on the basketball court 2-3 days a week like you better pay attention to that, right?
Right. I'll be 50 years old in about 4 months, so I got to maintain my body. I got to keep it healthy. So I do keep a very healthy regimen. Regular eye examinations on a yearly basis, dental examinations every 6 months. I see my chiropractor every 2 weeks to 4 weeks. In my medical doctor, I see him on a once-a-year basis. So it's different things that you can do naturally to maintain your health. You just got to maintain it and prevent problems from arising.
I was looking at your website, and among some of the services you offer, again, nutritional counseling, we talked about that, massage therapy. How important is massage therapy for some people?
That's very important because massage therapy, it reduces stress, it reduces anxiety, it relaxes the muscles, breaks up muscle spasms, and I should have named that also. I get a massage once a month.
Yeah, that's definitely one of